And just a short while after Quebec's Gisèle Lévesque got her shot, Ontario's first vaccine recipient got hers. So let's get right to our Magda Gebrselassie for that story tonight. Magda?
Well, it has been a long 9 months, Adrienne, and for some tonight, they can restart the clock. Captured in a flash, the first shots for frontline health workers in Ontario.
I'm excited because I'm the first one to get the vaccine.
Anita Quidangen is a personal support worker at a Toronto long-term care home. The Rekai Centre at Sherbourne Place saw 19 deaths during the pandemic. Today, its executive director also rolled up her sleeves.
We're doing this not only for ourselves, but mostly for our residents and their families, so that they have faith in us that we're offering the safest home that we can possibly do.
Keep people alive.
The head of the province's vaccination task force said today he is hopeful that these first shots will
help us see our way out of the abyss and the darkness we've had over this past almost a year now.
But it's still a long road ahead. Right now, there are 6,000 doses of the Pfizer vaccine in Ontario. The vaccine requires 2 shots. Another 85,000 doses are expected to be sent to sites across the province by the end of the year. But the second wave rages on with almost 2,000 new cases today.
The vaccine, like I say, is not the silver bullet to the problems in the healthcare system.
Those representing healthcare workers in long-term care homes are worried.
So there's still a lot of homes that are in a crisis right now, a lot of outbreak, a lot of deaths happening. So we've got to step up and make sure that we don't forget that there is a second wave here.
Even with the vaccine, provincial officials were also bluntly realistic.
We're not going to prevent the spread of the infection in the general population until we hit herd immunity. So it's very important people continue to do the basic measures.
The program to begin vaccinating the general public isn't expected to start until April.
Okay, so Magda, obviously a big day for Ontario, but what's next?
Well, tomorrow it is Ottawa's turn. Half of the doses in the province are in Ottawa. And again, it's going to be healthcare workers in long-term care homes that will be rolling up their sleeves first. Now, of course, everyone involved in this process, this is really kind of a learn-as-you-go process. And any concerns and problems that pop up in this next little while will really inform the process as more of the vaccination becomes available in the coming weeks and months, Adrienne.
All right, thank you, Magda. We'll be watching. That's Magda.
And I'd like to pick up, if I could, with Dr. Zane Chagla, an infectious diseases specialist who has been giving us great perspective on this pandemic as we sort of make our way through it. And Dr. Chagla, I have to wonder, when we keep hearing about folks regaining their freedom once they're vaccinated, because after that second dose, is it safe to start changing one's behavior?
Yeah, it's a really good question. And the answer is we don't know. And I think we have to assume, based on precaution, that we can't just yet. What we saw in the Pfizer trials was a number of individuals getting vaccinated. In the individuals that got vaccinated, the risk of symptomatic COVID-19 was reduced. Now, we don't know whether or not that means when they were exposed, they didn't acquire the infection and shed the infection, or when they were exposed, they were relatively asymptomatic and wouldn't trigger getting tested. The problem is if we don't know for sure if you are still able to shed the virus, then theoretically you're still a risk to others. And so those that were immunized in long-term care today, for example, if they persistently could still shed the virus, they really do need to adhere to the PPE just to make sure that their patients are protected until this part is actually sorted out.
Very important reminder. Dr. Chagla will be back a little later to answer viewer questions, so doctor, sit tight.